Well, hello and welcome to all of our gold viewers here today. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, another special day here today as we sit down with one of our speakers for our upcoming Gold Neonatal Conference. We've got Marie Viviers. She's going to be here with us, as you can see on your screen. Welcome, Marie. It's great to have you here.
Thank you. It's great to be here with you today.
Yeah, I'm very excited to introduce you and talk a little bit about your practice in just a moment, but I will let folks know that, of course, our conference for Gold Neonatal is coming up right around the corner here. It starts on May 26th. You'll be able to come to our opening keynote with Dr. Michael Narvey and listen to that presentation. So be sure to go to the website right now, goldneonatal.com. You can register there and, of course, get caught up with all the other speakers that are going to be at this live event. So it's going to be very exciting. And of course, one of our live speakers will tell you a little bit about what that means in a minute. Of course, is going to be Marie Viviers, and she's going to be here sharing about her topic as well. So Marie, welcome. It's great to have you here. You're going to be talking about evidence-based assessment of neonatal feeding, which sounds like a pretty big topic. But first of all, what I'd love to do is hear a little bit about your background. So, of course, with our international audience here, would you mind sharing a little bit? First of all, where are you in the world right now, and what is your background?
Okay, thank you very much for this opportunity, and thank you so much. I think the way forward for us now currently is working virtually to help us to equip all our colleagues working in the
Yeah.
neonatal unit. At the moment, I'm in the United Kingdom, in the UK, where I work at a children's hospital in an acute setting, and I also do some clinical academic work.
Hmm.
And previously, I started out my career in South Africa, where I qualified as a speech language therapist or speech language pathologist.
Hmm.
And I initially started working in a community service here there where we work 1 year for the government in any healthcare setting. And that's where my passion for mums and babies and supporting feeding
Yeah.
really started to develop. So my background came about in hospital settings as a speech
Hmm.
therapist, and then moving into and specializing in the field of my PhD in neonatal feeding.
Oh, that's just amazing. And you and I were just talking about, I always love it that, we can really sort of highlight, what speech, language pathologists and therapists do in the NICU, because I think often, often you don't get highlighted enough because it's very intensive. There's a lot of work that's done by our physicians and our nurses, but there is a big role for you that you play in the neonate. Was this something that you saw early on in your practice? And I mean, I want to know because it's a very wide range of things that you can actually do as a pathologist. But was this something immediately that you were drawn to, that you were like, okay, this is where I want to go? How did it all come about for you?
I think for me, basically in South Africa, when we started studying the undergraduate degree course, it's a 4 year degree in South Africa.
Right,
Um, Neonatal feeding and pediatric feeding was not even a
right.
compulsory topic in the curriculum. So
Wow.
I took a selected course on that, and
Yeah,
I had a wonderful mentor, a professor at the university. And when I had to do my honors dissertation, I looked
yeah.
into the role of the speech therapist in the neonatal unit, because we were really only a few therapists at that point interested in working in that field back in 2000, 2003 in
Hmm.
South Africa. So it all, for me, this was an immediate passion from the beginning of
Wow.
my career. I then went into a master's degree in the field of early intervention, so working
Right,
with infants and families 0 to 3 years, and
right.
then from there progressed into teaching and lecturing at university a little bit, and then
Hmm.
working in the multidisciplinary team and really expanding our role in working with speech, language, and listening skill
Sure.
development in the NICU, and then as well as focusing and supporting feeding for mums and babies in the NICU.
Well, it's an amazing job, I think. When I look at the spectrum of skills that you can have and where you can go, I mean, right the way through from a neonatal, right through to perhaps an older person as well who's struggling with different ailments. I certainly personally really appreciate the field. I've had the opportunity to work with many speech language pathologists, and as an IBCLC, I just see there's just so many things, even personally with my own children. There's been, definitely definitely great ways that I've been able to utilize speech language pathologists professionally and personally. So thank you for, keep working in this field. It's a wonderful representative to have you here and talk
Oh,
about it. So
thank you
thank
very
you.
much.
Yeah, it's wonderful. Okay, so let's go back and talk about exactly what your role might look like. Perhaps when you're on the ward, tell us when you would be brought into a scenario. Are you there for all of them? So just so that you people understand kind of how you could be best utilized.
Okay, so I think in different settings in different countries, the
Hmm.
NICU's levels of intensity is a bit different. So we
Sure,
are usually utilized at the point where the baby is perhaps considered a little bit more medically stable,
sure.
and we would be brought in for children with a variety of prenatal diagnoses,
Hmm.
or then parents getting a new postnatal diagnosis such as trisomy 21
Right.
or hypoxic ischemic encephalopathy
Hmm.
or birth trauma that happened. So there's quite a
Right.
variety of
Wow.
babies and families where we get called in early,
Right.
especially at around 32 to 33 weeks of gestational age and babies are
Hmm.
born prem. We would work with those premature infants, and we will work together with the neonatologists on the unit,
Yeah.
our nursing staff, and we would join a feeding ward round with them initially in
Right.
my setting, where we work. And
Yeah.
then there's also the assessment. Then from the beginning, we help mums to establish skin to skin contact, then
Oh.
get involved with the feeding relationship that's so precious from early on, sucking stimulation,
Hmm.
positive touch, building that into the nursing practices on the ward as well, and then supporting our nursing colleagues for those babies where we specifically are also concerned about swallowing safety during
Sure.
feeding.
Yeah, absolutely. And that's just beautiful. I mean, it's just such a, again, sort of a wide range of things that you can really support in. How do you find working with the families? Because this is a very intensive time, being on the ward when you have a little neonate there. So, do you work with the families directly? Do you get to put a plan in place for them going home? What sort of roles would you see yourself doing there?
So at the moment, I think from the beginning, we of when I meet the parents the first time, usually I kind of try to build rapport around how was their birthing experience,
Hmm.
what mom is looking for in terms of this kind of feeding consultation, because usually the
Sure,
doctors would say, that is why they called us in, is to help with feeding.
sure.
So what mom and dad wants from that, because often for my first initial consultation, both parents would be present.
Hmm.
And what I've then from that point on, it's kind of working with what mom and dad want. So, firstly, establishing, do they want to breastfeed? Do they want to bottle feed? What
Hmm.
is their journey as a family going to look like? And for a lot
Right.
of them, it's very uncertain.
Hmm.
So they would kind of put the ball in your court as a professional a little bit as well to say,
Yeah.
well, what would you suggest is best? So I
Wow.
try to really consider the family's wishes, but then also give them, informed options of
Right.
feeding and developmental care and how we can then support them to get feeding in place. And we then come up with a collaborative feeding plan. And that
Beautiful.
feeding plan is usually shared with our neonatal nurses who are there most of the day on the unit with our little
Yeah.
ones and families. And then from there on, we would consult as needed as well.
Oh, that's so wonderful. And it's so nice to be able to collaborate. And of course, we know that parents play a huge role in the response to their infants, when they're
Yes,
in the
definitely.
NICU. And that collaborative type of care is really what I think families are looking for, right? So I think I sense that this a fair amount of counseling that happens. You're talking about their
Yes.
birth story and
Mm.
what they would really like or what they would like to see. But it's very scary for a lot of families. So it takes a bit of time for them to process what's happening. So it's good to hear that you're there with them, Marie. So I appreciate that. It's wonderful. Thank you. All right, let's talk about your topic. So, this topic is I know that you've got in here evidence-based assessment for neonatal feeding. So tell me, what's behind this? As far as a topic, what should we expect to understand and learn from you here at Gold Neonatal?
So I think what my focus was and why I specifically chose to kind of slip the words or the terminology evidence base in
Yeah.
there is that a lot what we do is driven by science, the
Hmm.
science of neonatal development, the
Hmm.
science of parent-child interaction, the science of how families work in certain systems,
Hmm.
and the research of how we support development at the right time and especially at the right stage for a neonate.
Right.
So, from evidence-based point of view, I kind of want to introduce the audience to the different theories and models that
Hmm.
kind of led to my way of how I assess infants and babies, and how a lot of speech language therapists and pathologists out there assess babies and infants in our NICUs to ensure to parents especially, so that
Right.
therapists, other clinicians can feel confident that what you are doing with families and parents are supported by the science and the research out there currently.
Yeah, absolutely. And with some of that evidence too, I mean, I know that we're always sort of trying to work within those parameters, but it's also can be very unique case by case. And so
Yes.
it takes a bit of time to work through some of these things. How does that sort of all play into we often talk about how we can move forward in the NICU and then sometimes we have to
Yeah.
take steps back. So how does that play out in looking at some of the evidence? So we always going back to, looking at the evidence, or is there some observation that we take and we need to be careful for those individual cases?
I think at the forefront of everything is individualized care for that
Hmm.
baby. So we are very much guided by clinically what we see in our baby at
Sure.
the bedside, when there's skin to skin contact, when
Hmm.
there's initial nuzzling at the breast, when they go to the breast, observing the feeding diet. So we are very hands off. We don't want to disturb that relationship initially,
Mm.
but then observing and interpreting the cues the baby is giving us, and
Right.
kind of guiding parents and mums that feel very fragile and vulnerable at
Mm.
times in the unit
Yeah.
to really show them the positive attributes in their baby that's already present and that they can
Mm.
already interpret. So it's kind of guiding each individual mum and baby with
Right.
very careful clinical observations to
Hmm.
find a rhythm for their feeding, a safe place in that feeding to
Yeah.
compensate for what our little one is struggling with, and to also give parents an overarching view as a clinician of where we are going in terms of your infant's developing and what can they expect next in the next few days, because our babies literally change from day to day when they
Yeah.
are in here, and we need to realize that when we assess. So assessment is kind of, from my perspective, never fully done. We have
Right.
to kind of every
Yeah.
day, it's a continuous serial process that every
Yes.
day there can be adjustments we can make as our little ones develop and progress. For example, from full tube feeding to oral feeding, there's quite a
Hmm.
few steps in between, and we
Sure.
can be there along that pathway as clinicians to support parents with that.
Yeah, yeah, yeah. Because I was trying to figure out, because you're going to be talking about the neonatal feeding assessment scale, and I was trying to figure out,
Mhm.
how valid is it? Because we know that things move quickly. Sometimes we need to take steps back. A lot of
Yes,
observation, and you're doing a lot of teaching, and there's so many variables because, like you said, we've got fragile parents in there and babies, and so we're trying to match them together and teaching them on the
definitely.
go all the time. Wow, there's a lot involved here. And I think it probably takes an immense amount of patience and, of course, time. And time is of essence in our NICUs as well.
Yes, definitely. And I think it's that complex situation and the complexity that drew me initially. And when
Wow.
I developed this tool, it
Yes.
was a way of organizing in my own mind all these elements that I need to be aware of when
Right.
I'm there with
Ah,
the mum and the baby.
right.
And that led to kind of the development of a structured tool that can
Right.
be used literally every day with a little one to guide
Right.
you in a structured way. I think
Hmm.
after a while, as professionals that work in the field for a long time, you do develop obviously your own clinical skills and intuitive way
Sure.
with parents and
Yeah.
families. So I also initially thought this tool might be directed at clinicians coming into the field a little bit more to
Sure.
help them to develop those skills to observe babies. But I see it kind of as a tool to measure progress in our infants, to show to parents, this is the emerging skills that your baby has that they are
Right.
doing, and this is what you are supporting. So I don't see it as a one off test, so to speak. It's
Yeah.
more of a serial assessment tool over time that you can use.
Yeah, absolutely. And I know, like, as a clinician myself too, I mean, tools are very valuable. I sometimes going back and revisiting those tools, because I mean, there's no doubt you, even in a career for some time, you come across those babies and you're just at a loss. I'm like, okay, I need to go back to basics, and
Yes.
really look at this. So having those tools can really be invaluable for so many folks, I'm sure. So that's wonderful. Well, I can't wait actually to hear more about this tool, how it's implemented and how it can be useful. It'd be great to hear that. And of course, more of your experience and really how these assessments can, change and on a daily basis, as you
Yes.
said, and what you can
Definitely.
do, when we're struggling, because I think that's some of the concerns too when we have a little neonate that's just not responding the way that we would like, right? We've always got
Yes.
those we've always got those aspirations and we want to see those
Mm.
babies do so well, but sometimes it takes time and we need to evaluate regularly on what's happening. So this is excellent. Thank you so much, Marie. This is going to be great.
It was a pleasure, and I'm really looking forward to kind of also learning from the audience and everyone else from
Yes,
their experiences and how this tool might be useful for some, and others might
sure.
just take away other learning points from it. And in that
Yeah.
way, we can all share amongst one another.
Absolutely. Yeah, this is going to be great. And of course, here at Gold, that's what we're all about. We're all about collaborating and engagement and working together. So I encourage all of you listening right now to please, I mean, come to our live events. They're going to be fantastic. I was going to tell you that. So we've got Marie's going to be here with us on Tuesday, the 2nd of June, for most of you. Okay. So I always say that please, if you're an international around the world, check your time zone on our website, right, at goldneonatal.com. We want to be sure that you can come because if you come on the live day, we can be here. Marie's going to be with us. She's going to be answering questions as well as part of her presentation. And she's got some great engagement as well. So be sure to come in for that live event. Now, of course, it will be recorded, so you'll be able to listen to the recording. And exclusively just for our delegates, we have our forums. So you'll be able to ask those questions as well to Marie after the fact as well. So there's lots of time to really work together on this particular presentation, which is going to be wonderful. And of course, you can drop comments below right now if you have any questions ahead of time. I know that Marie would love to see those as well. So again, thank you so much, Marie Viviers, for being with us here today. It's wonderful having you here at Gold Neonatal.
Thank you. I'm looking forward to joining you guys for the live day on the 2nd of June.
Excellent. And thank you again to all of our Gold viewers here. Don't forget to go to our website at goldneonatal.com to check out all the latest news and what's coming up with our conference and register right now. Thank you again, everyone. Bye bye for now.